First, ask the patient to put away the cell phone and other metal objects that are in contact with the skin. Notice that the electrodes are connected correctly according to the standards and the screws of the electrodes are tightly closed. Start with the limb electrodes. Attach the limb electrodes to softer areas of the skin just above the wrists and ankles. Wipe the electrode application areas with alcohol and rub ECG's conductive gel if it is necessary. Make sure the electrodes are clean and will contact with the skin. Black clamp is attached to the right leg ankle. Green clamp is attached to the left leg ankle. Yellow clamp is attached to the left hand wrist. Red clamp is attached to the right hand wrist. About attaching the chest electrodes, at first squeeze the silicone cups to affix the electrodes to the application areas. Usually, it is necessary to use conductive gel for proper connection of chest electrodes. The chest electrodes should be attached to the locations as follows. V1. Fourth intercostal space at right border of sternum. V2. Fourth intercostal space at left border of sternum. At the horizontal level of V1. V4. Fifth intercostal space on left midclavicular line. V3. Fifth thoracic rib between leads V2 and V4. V6. Left mid-axillary line at the horizontal level of V4. V5. Left anterior axillary line at the horizontal level of V4. Push the on-off button to turn on the device. Wait for image loading. The device will enter the online screen after a few seconds. Ask the patient to relax and keep his or her hands away from her or his body. Also, ask him or her not to punch his or her hands at all. Otherwise, the muscle artifact will reduce the quality of the ECG signals. All 12 channels should be displayed on LCD. Notice that the lead failed or inoperable messages are not being shown on the screen. Push the Start-Stop button to enter the signal preview screen. If the signal's quality is not desirable, push this button again to reach a better signal. After confirming the signal, then press the F6 button to print the ECG with defined format. In the end, the printing will be stopped automatically.